Today's diabetes case study is about Emily. Emily has diabetes and she's facing a dilemma. See if you can help her. The background of this case study is this. Emily's diabetes has been well controlled until recently. At a recent follow-up with her doctor said to her, "Emily, your latest blood test results shows that your blood sugar control is not good. But I will not increase the dosage of your diabetes medications for now. Let's do a retest in 2 months, and in the next 2 months, try your best to improve your lifestyle and eating habits to better control your blood sugar. And if there is enough to bring your blood sugar down to more ideal levels, great. But if your blood test in 2 months' time still shows poor blood sugar control, then we would have to discuss and perhaps consider increasing the dosage of your diabetes medications." Emily left her doctor's clinic in a dilemma. Emily's dilemma is this. She has a group of very close friends who share a common passion, food, and they meet at least 2 to 3 times a week to eat, and almost invariably over food that are obviously not good for her diabetes control. "What should I do?" Emily thought to herself. "Should I ask my friends for their support to avoid choosing eating places or foods that are obviously not good for my diabetes for regular gatherings? Would they even agree? Would they be unhappy even if they do agree? Should I just go out less often with this group of foodie friends so as to give myself a better chance of changing and improving my eating habits? Or should I just accept that increasing the dosage of my diabetes medications would be the easiest choice because changing and improving my diet to improve my blood sugar control would probably be too difficult?" If you were Emily, what would you do? Which of these 3 options would you choose? Number 1, ask your group of foodie friends for understanding and support as you try to change your diet. Or number 2, change how often you go out with that group of foodie friends. Or number 3, just resign yourself to accepting that change in diet might be too difficult and just accept that increasing the dosage of the diabetes medications is inevitable and perhaps the easiest option. If you were Emily, which of these 3 options would you choose to do? Can I ask that you share your thoughts in the comments section below? If I were Emily, regardless of whether my friends are going to be supportive or not, I would not give up the opportunity of being able to improve my blood sugar control through eating habits change and improvement, so as to avoid the need for increasing the dosage of my diabetes medications, whilst the window remained open to still do so, because health is precious. And when it comes to lifestyle-related chronic conditions such as diabetes, we must not depend on the use of medications alone to control and manage the condition. We must unlock the power of a lifestyle and eating habits to optimally manage and combat lifestyle-related chronic conditions such as diabetes. I'm Dr. Chan. Let habits be thy medicine. Eat well and be well.